You're watching TVC Breakfast. Now, treatment of terminal diseases on the African continent can be distressing.
And here in Nigeria, 17,000 new cases of chronic kidney diseases are diagnosed yearly, and of that number, only 2,000 can afford dialysis treatment. One session for dialysis costs between 20,000 to 30,000, and a patient needs to undergo dialysis 3 times a week.
Dialysis is not a cure for kidney failure. It is a continuous treatment the patient gets until he gets a kidney transplant, a procedure that costs between 7 and 10 million naira. Now, many Nigerians suffering from chronic kidney diseases die because they either cannot afford treatment. Joining me now is an organ donor ambassador, Hilaria Asumu. It's good to have you join me right now.
Thank you.
A lot of people will say, Hilary, Hilaria, Hilary, Hilaria.
Yes, they do, yes.
But it's good to have you join me.
Thank you very much.
Now, when it comes to the issue of organ donation, we don't seem to have that so much on the African continent, especially even in Nigeria. People have a lot of attachment to these things. Are they cultural or they're just social issues?
Well, basically, I think that most people, it's cultural and it's also religious beliefs, and also fear of the unknown, really, because when they think about organ donation, they're thinking they're going to cut out the organ from my body, by force, and, I'll be left to die. And usually that fear stops them from actually stepping forward to become organ donors. Notice that in the Black community in the UK. Now, I am an organ donation recipient. I got my transplant last year after 10 years of being a kidney disease patient. And it was really, really hard for me. And when I got it, I thought that I have to do something for those people who do not have a voice in the Black community. So I started my campaign from the UK. And I had to be in the UK for about a year before I could travel to Africa. And this is my first time in 5 years.
How are people receiving your campaign? Well, especially in Africa or in Nigeria?
Well, in Nigeria, I think they're a bit, skeptical. They're not sure about me. They're not sure what I'm actually doing, if I'm doing it because I want to do it, or because it's if I'm an expert, and also if if there's some reason behind it.
All right, but what do people have to know? What do people need to know about the safety of donating organs?
Well, what they need to know is that first, when you step forward to become an organ donor, well, I know from the UK, I don't know about Nigeria because this is my first time in the country talking about it. What they need to know first is that every test is done to make sure that the person is suitable to actually provide that organ to that person. So you go through psychological tests, you go through blood tests, and that could take up to a year to 2 years. Okay. And after that, you sign up. It doesn't mean that they will take it from you right there and then. It's when you die, when you sign up to become an organ donor, when you die. And the only time they can take those organs is if you die in certain conditions. You will not, your organs can't be used if you die outside of the hospital, on life support, and you've been tested to be actually brain dead. Now, another thing about the process is that even if you sign up and you tell your family that you want to be an organ donor, if one person in your family disagrees, the process doesn't go forward. I think that's a system that could be brought into the Nigerian system, and that's one of the reasons I'm doing what I'm doing. All
right, that's quite interesting. Now, what organ can be donated?
Well, you can donate everything, really.
Wow.
Tissues, stem cells, heart, kidney. I'm a kidney disease recipient. You can also donate your corneas. You can donate intestines, up to poop.
Wow.
Yes.
Wow.
Yeah.
All right. So how challenging do you think that this is going to be, making Nigerians understand and then open up to the idea of donation when they are dead?
Well, it is an uphill task currently. getting even educated Nigerians to get their heads around organ donation. So I think that to get there, it's a lot of work because of all those cultural beliefs, all those fears, and also the rumors, the myth that going around on social media. A lot of people think different things, and when you go and talk to them about it, they say, no, 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 I would do the blood donation, but I won't do the organ donation. And they don't realize that for organ donation to be successful, it needs to come from from somebody from the same racial background.
Yeah.
And usually, when people get an organ donation, their life changes. It's a gift. It's a gift of life. It's a second chance at life. Okay. And doing that, it gives them a sense of purpose, gives them a sense of, having done something. Okay. So they have to think along those lines.
That's contributing to humanity.
Yes.
But your case is different. You are a beneficiary of organ donation.
Yes.
Tell us more.
Well, my journey started in 2008. And I had a miscarriage at 22 weeks, and that led to septicemia and multiple organ failure, which meant that both my kidneys shut down, and I lost both of them.
And it's not like you had a history before this, okay? It
no,
was
not
all
at
pregnancy induced somehow?
I don't know what happened because it happened suddenly. So I woke up. When I woke up, it was 2 weeks after because I was in a coma for 2 weeks in the ICU. And I think it was on the day they were supposed to shut the machine down. That's when I woke up from my coma. Yes, wow. After 2 weeks, yeah.
So and then you benefited from the from organ donation. So what brings you here? Thankfully, you're alive, and look at you now. You're looking so radiant. So what brings you here to Nigeria?
Well, I'm in Nigeria to actually campaign for organ donation. And also, I'm bringing a new project to Nigeria, which I don't think a lot of people have access to, which is a free dialysis center for people on low income with kidney disease. I'm doing this because I'm grateful to my donor family, because a mother who lost her son had the presence of mind to think she could help other people and allowed her son's organ to be used to improve somebody's life or give somebody a second chance at life. It's a gift, and I want to give that gift back to people, not just in the UK, but because I come from Nigeria, I'm a Nigerian before I'm British, and I want people to know that there is hope. They can actually do dialysis free of charge without having to worry about where the next money is going to come from. I've been sitting there in the UK hearing stories in the 10 years I've been a kidney disease patient of people dying from kidney disease. And
another way to even look at it from this donor that you're talking about is he lives on, so to speak.
Yes.
He lives on. So what's different between there and now? How do we better our system here in Nigeria to, make it at par to deliver more to citizens in need?
Well, I think first, I think the government or the Ministry of Health have to do something about educating people about kidney disease, how it happens, the causes, and how they can manage themselves. And not just that, provide a system where they can have free dialysis up to a certain point, especially for people on low income. People who are rich can afford it. They can fly out and get the treatment or buy the machines and come back home and treat themselves at home because you can self-manage. But for people who are poor, they can't afford it.
And how do you go around cultural practices that bar people, Nigerians, Africans, from donating their organs?
It's raising awareness. That's what I do in the UK, because even if the information is out there, they have access to it. Nigerians, Africans will not access it. So it's to raise awareness, get a campaign going, just like they're doing in the UK, getting people who've been through it to become ambassadors of organ donation, and getting them to speak to people about their experiences, just like I do on a daily basis in the UK, going to events, going to birthdays, funerals, talking to people and educating them and telling them that this is what you can do, because one person can save up to 8 people. And if they donate all the organs, including tissues, they can save up to 85 people.
That's amazing.
That's amazing.
Now, you have been in the UK and you are a beneficiary of, organ donation.
Yeah.
Now, talk to us about how it operates in the UK. How much of people are benefiting from this idea, and how aware are Britons in giving out their organs when the time is due?
Well, currently in the UK, I think they've got it right at the moment, because they're using recipients to, get the message out there to the population that there is hope and you can, get a kidney. Treatment and everything is done on the NHS, and, everybody is on board with what they're doing. Now, in terms of getting people to understand about, the process, as I said, using ambassadors, there are campaigns going on currently right now in the UK, and they're using my video and my story to sensitize the Black community. The white community, it is not a problem. People come off the streets to donate altruistically to people their organs. Well, you can donate as a life donor. You can donate a liver or a kidney. So because the liver regenerates, so you can donate half or a quarter of it, and it just grows back to its normal position. And for kidney, you can survive on one kidney. But with the Black community, it's really hard. As I said earlier on, it's about the belief, it's about the fear, it's about the culture, it's about, in Nigeria, ritualistic, practices as well.
But now that you are in Nigeria, how are you getting these messages across to people?
Well, just like I'm doing today, talking on TV and also talking to people and also on social media as well. I'm a recipient of the Tony Elumelu Foundation Award. So what I'm also doing is also talking to people on that particular platform.
All right, so what's the level of acceptance so far from people who have heard you?
Well, it is not great because, as I said, because of the previous issues around organ donation and the fears and cultural beliefs, it is really hard getting across to people. And I'm hoping that this time in Nigeria, as I'm here, I can actually do a little bit more and, sensitize people, raise awareness about the benefits of becoming an organ donor.
Right. The society in the UK and the society in Nigeria are two different. They are polarized when it comes to the standard of living and all of that.
Yeah.
Now, in Nigeria, for instance, where you meet anyone and they will say, okay, if a person or myself is going to donate this, I need to get this kind of token back and all of that. Are you getting things like that? Are you hearing things like that?
No.
Or is that acceptable?
It's not acceptable in the UK because nobody pays for anything. I, for one, I know I didn't pay a dime, including my medication, the operation, the donor who gave me their child's organs. I didn't have to pay for any of that at all. It is not allowed. You have to go through a process. If your family is donating to you, they have to check that you're actually family and you're not paying a dime to them because it's unethical. Nobody would do it. They tend to tell you right from the start, if you're paying for this, it is not allowed. It's against the regulations. You cannot go there. So nobody does that. I know in Nigeria, people have to pay, and that's what I'm trying to talk about, what I'm trying to get people to understand, that you can actually donate without expecting a payment. It is that sense of belonging, that sense of achieving something that would help people to, try as much as possible to help their fellow human being. Right. They are our brothers and sisters. Why would we want to be paid
to
help them?
So it's about helping humanity.
It is, yeah.
All right. Thank you very much, Hilaria Sumu, for coming on the program.
Thank you very much.
I wish you well in your assignment and campaign.
Thank you.
Thank you.
Thank you.
Right.